Welcome, everyone. We are at fascinating crossroads. Thanks to incredible medical breakthroughs and better healthcare, people across Europe and here in Slovenia are living longer, healthier lives. But too often, the focus around ageing populations is about the rising costs associated with this. I'm here today with Professor of Economics, Jožetom Sambtom, where we are going to talk about this and challenge this narrative. Jože, you are researching the impact of demographic change on the long-term sustainability of public finances. From an economic standpoint, why is it dangerous to look at ageing purely as a fiscal burden?
Hello, thank you very much for having me here. Indeed, we are living in fascinating times, just like you said. For example, less than 200 years ago, life expectancy at birth was about 45 years, and now we are approaching 90 years, females in Japan, which means our life expectancy is increasing by 2.5 years per decade, which is impressive. However, in the following 3 decades, we will face challenges, just like you mentioned, in terms of public sector pressure on pensions, long-term care, and healthcare. So from one side, I understand these worries that we should limit costs, but on the other side, those costs are not just costs, but investments. And if these investments are justified, they have positive returns from an economic perspective, then that's something that we should seek in those difficult times in the future decades to take advantage of these investments.
I completely agree. And when we look at the intersection of health and economic policy, we see a massive gap between what is scientifically possible and what healthcare systems can deliver. I often hear this referred to as 21st century medical breakthroughs trying to fit within a 20th century healthcare system. Narrowing the gap requires us to change how we define the value of innovation. When a new medicine or a diagnostic tool is introduced, the immediate reaction from payers is often entirely focused on the upfront acquisition cost. What are your thoughts on this?
Exactly. HTAs, so health technology assessments, are taking into account this narrow payer's perspective, but ignoring all the broader impacts that these investments have on economy as a whole, but also long-term impacts of those investments. So, for example, if investing in some treatments, we can then avoid hospitalization and related rehabilitations and then disability later on, and also costs related to help for those disabled persons and so on. So all these costs taken into account, then we can get complete picture. And the biggest element is those people, if they are healthier and working longer, can produce much more. So we are talking about absenteeism, presenteeism, avoiding disability pensions and so on. Just few numbers or a number or two. Around 55,000 or even more people are on sick leave in average every day in Slovenia, which causes costs of about 700 million euro per year, just taking into account our health insurance institute of Slovenia. But if we take into account also costs that employers and so on face, then we are close or even above 1 billion euro.
So the concept of keeping people in the workforce, it seems very impactful and quite simple to understand, actually. I can see it underscoring a proactive approach, building on the robust prevention, early detection and timely treatment that will be critical to provide that continuum of care to allow people to be in the workforce and be working members of society and earning and contributing for longer. So the macroeconomic data backs this up completely. A landmark PwC study tracking a 10-year period across Europe showed that innovative medicines alone added 2 million healthy years to people's lives. Those health gains could be then calculated what that contributed back to society, alone injected a massive 27 billion boost back into the economy. Jože, how does this societal return manifest in your own recent meta-analysis?
True. recently we done meta-analysis, so we were comparing what other studies have found. And especially for chronic progressive diseases like multiple sclerosis, for example, or for rare diseases like hemophilia, causing all kind of problems, health problems in the long run. So those bleedings in joints and the need for replacing joints and so on and so on. Or also focusing on cardiometabolic diseases, there can be huge benefits and positive investments if taking all these broad social dimensions into account. For example, €1 invested in multiple sclerosis treatments can yield 1.8 or even more euros if taking into account all these dimensions.
Well, these numbers are impressive, and these disease areas are also very important. What about areas like oncology? And the costs in oncology are a frequent topic of conversation, particularly across the world, but also here in Slovenia. A recent Y4 data shows that in 2027 alone, HER2-positive breast cancer will be costing European economies over 24 billion in lost productivity.
Exactly. Oncology is another such topic where it's very, very important that we target the right patients. So with early diagnostic, proper diagnostic, to eliminate patients where the costs would be in large extent unnecessary. But we can do that, and then positive impacts is huge. Again, for example, saving someone who's at age of 40 then brings back a lot of productivity and production into the picture. But also earlier I said, for example, cardiometabolic conditions or diseases, once we eliminate or avoid strokes or heart attacks, these are again then huge benefits, but only if we consider long run and all this broad social perspective.
So what I'm taking from this is it's clear that infrastructure and policy are just as important as the scientific discoveries that we make in our labs. We can create the most groundbreaking targeted oncology treatments, as you mentioned, but if the local healthcare system is not ready to adopt them quickly, then the benefit doesn't reach the patients, the healthcare system, or society. And overall, the economy loses out. So what systemic shifts or financial frameworks are required to stop measuring healthcare by the immediate cost of delivery and start valuing the long-term investment or ROI of a resilient, productive society?
For example, those HTAs that I mentioned, I think they should be modified, not just taking into account this narrow payers perspective, but to include all this broad social aspect as well. So methodologies should be synchronized, developed, done in the same way, so we can then have this broad aspect in our minds. But also for the time dimensions, so we should also introduce indefinite future, so not just current cost, initial cost, but also all these invisible costs that are then avoided down the road, which are just forgotten otherwise. And coming back to my initial statement, how our lives are extended, how much longer do we live, it's also in large share or in large part because of that. And it's often ignored. So I think this should be bring back. And also I think some supranational or some broader context should be set up. For example, aging working group where I'm active on the level of European Commission, we are following retirement, so costs for pensions and then long-term care and health. But this should be somehow related. I think if we live longer and we work longer and we are healthier, this impacts also then when we retire and so on. And if this would be followed every 3 years, just like it is now for just this broad aspect of pensions, healthcare, and long-term care, then there would be some motivation, there could be comparative results and so on to take all this into account.
I hear you talk about a working group, so that suggests collaboration. It's clear that industry can't do this alone. Governments can't do this alone. Academic institutions can't do this alone. So there clearly needs to be a shared vision where across the sectors where we can all work towards this vision. Do you agree?
I totally agree. I totally agree that there should be all these stakeholders included in the decision process, in analysis and so on. So not just the payer's perspective from a myopic point of view, just how much are the costs today, but how much will be the costs and avoided costs tomorrow, after tomorrow, and so on. And I see all these stakeholders, not just the payer, but also, for example, clinicians, then someone who would be representing economy as a whole or public sector. Because if we produce more, we stay longer, healthier on the labor market, then also public sector collects more taxes, pays less disability pensions, less transfers, and so on. So another stakeholder, of course, I see industry, and another stakeholder for sure is patient representatives or unions, because patients are those who are carrying much further or much more costs also from their own pockets. It's there who will be then more productive, not just on the labor market, where also stakeholders should be employers, but they will be also more productive in household production, so they will be able to cooking more, cleaning more, taking care of their children, grandchildren, and so on. And they are also the stakeholders who will live longer lives of higher quality, which should also represent an important factor and value to these calculations.
I couldn't agree more. Patients and citizens should be at the centre of all of this. So let's just focus on Slovenia for a moment. What do you see as the biggest opportunity here? Where could Slovenia make the greatest progress in strengthening both the health outcomes and economic competitiveness that you've been talking about today?
Okay, so I will just limit to this research connection with clinicians and so on, where I'm active. And I see a big benefit or opportunity here because we are relatively small or right size to be very efficient in connecting all these fields, because it's a big step, I think, understanding each other, collaborating with clinicians, collaborating with associations for, multiple sclerosis, for example, and then to build up this picture, the whole picture, but also some systems, some research model that can be then also applied to other countries and to other areas. And I think we can be very collaborative here. We have very good data, and that's how we can be, I think, a good model for scientifically or professionally building up the system and approach to see investment or expenditures for health, not just as costs, but investments with return on these investments that can be quite high, and that will be very relevant in the future once we will be challenged with population aging.
Professor Sampt, thank you so much for sharing your insights today. We come from different sectors in the healthcare system, but we clearly agree on many things, and we look forward to further collaboration and conversation.
Thank you very much.
Thank you.